So what's missing there is that when they do testing, they're looking for gross levels of things being too high, things being too low in your blood test. Certainly doing scans and looking for tumors, and they're looking for sort of the big bad thing that could eventually get there, but because it's not at that point now, they don't know what to do with you. So also, it's important to realize that our blood tests have a very wide margin of what's considered normal and okay, and it is way too wide. So what needs to be done is that, and this is something we do with our patients, is show them here's this normal that supposedly is normal, and then here's optimal. It's a much more narrow range. It's a much more sensitive level, because as you well know, you can feel terrible yet be told you're fine. Your blood tests are fine. And the other problem with that is that just a blood test is not enough. A blood test does not look at whether you have food reactions or food sensitivities. A blood test does not measure your microbiome, that's 60 to 100 trillion organisms in your gut, and say, do we have inflammation? A standard blood panel is not looking at sex hormones. It's not looking at toxicity like mold or heavy metal. It's not looking at any of those things. So when you're told you're fine and you don't feel fine, know that there's a reason, and it's not your fault.